Kia ora. Hi, I am Krisha. I finished my Bachelor of Science in Nursing in 2006 and Master of Arts in Nursing in 2010 at St. Paul University, Iloilo in the Philippines. I came from the batch Gaudium Fidelis Pacis, the Faithful Guardians of Peace. I had 3 years of ICU and CCU training in the Philippines. Moreover, I worked for 3 years in an acute mental health inpatient setting. I also work as a clinical nurse educator and professor to nursing students, supervising them in the mental health setting, and taught subjects on pharmacology, pathophysiology, normal growth and development, and mental health. Arriving here in New Zealand, I took up a course on cognitive behavioral therapy and completed a 3-month nursing bridging course in Whangarei. My heart has always belonged in mental health. I now work in OPR1, formerly known as Ward 30, Mental Health Services for Older Persons, Acute Inpatient Ward at Waikato District Health Board, Hamilton. I work in a 15-bed capacity acute inpatient ward for people 65 years and above with a functional disorder. Our clients include people with functional disorder or dementias with associated significant psychological and behavioral disorder, behavioral and psychological symptoms of dementia. We work alongside with psychiatric assistants, doctors, social workers, psychologists, and occupational therapists. I have been working in the ward for a year and 6 months now. Indeed, learning has not ceased for me here in New Zealand. I was sponsored to do postgraduate studies by the Healthcare Waikato, New Zealand, and TEPO. I have just finished my postgraduate certificate paper on assessment and clinical decision making in mental health. Currently, I am doing a course on nursing people in acute mental health crisis. Taking up nursing was never my first choice. Mom encouraged and persuaded me to have a go at it because my eldest sister is also a nurse. Eventually, I learned to love it by heart. Because of nursing, I learned to become a multitasker, a healer, an educator, a teacher, a client advocate, a counselor, a leader, and a change agent. My clients and patients lean on me for support, guidance, treatment, and nurturance. I became a role model to my nursing students here in NZ and in the Philippines for knowledge, wisdom, care, and compassion. And for my family, I gave motherly care and became a source of inspiration to them. Working in the Philippines and here in NZ, I say they have their own unique qualities, especially when you're working in the mental health. Being a migrant here, you have to adjust to different personalities in the workplace and meet challenging patients along the way. I have experienced being physically and verbally abused by client, hit, punch, slap, kick, bit, chased, so forth and so forth. These are my challenges being a mental health nurse. You ask, how do I get courage and strength? When I see my clients recover and become well again, when they thank and appreciate you, when you have formed a therapeutic relationship with them, these are my simple joys. Challenges slowly unfolding to become sweet successes. Being a Filipino Polynesian nurse, I always carry this with me. Caritas Christi urget nos, the love of Christ impels us. Every Polynesian is driven by love. You are driven by love. I am driven by love. All of us driven by love, which was inspired by the love of Christ for others. Our hearts go out to others, reveals itself in service. I go back to my roots and apply values of being makajos, makatao, makabayan, and makakalikasan in my daily work here. Having been educated in the Philippines made me a caring and competent Christian Filipino nurse who is a total person, compassionate and competent, self-directed, and a leader. Hence, I always believe in this mantra, always make a difference. As a Filipino nurse, these are the traits that I am proud of. God-fearing, caring, nurturing, empathetic, hospitable, humble, respectful, compassionate, creative, flexible, optimistic, and we have the pakikisama trait. It has always been unending learning for me. Throughout my nursing profession in the Philippines and here in NZ, I have learned the principles and values of safety, integrity, ethics, compassion, and empathy, which will further guide me into becoming a more competent mental health professional. As nurses, we are advocates of respect, trust, partnership, and integrity. That is why we treat our clients with respect and establish trust in our relationships with them. Working as a mental health geriatric nurse is indeed a genuine personal service. Even though how tough the challenges are in the mental health setting, it is my innate passion to be helping the older people, which make my profession worthwhile and meaningful. Lastly, I've always believed that nursing is an excellent ministry of service. Hope you were inspired with my life on becoming a nurse. Choose a vocation that your heart desires. Have a good day and God bless. Hey Konara, goodbye.